Good afternoon. I'm Terry Brown, a student in the Masters of Healthcare Administration. I'm here this afternoon to interview Scott Andritsch, the CFO of Sullivan County Community Hospital. He's agreed to meet with us today to discuss some of the financial and insurance reimbursements. Here you go, Scott.
Hello.
Okay, first up on our agenda, I wanted to speak with you on the specific financial and health insurance related issues and activities of the hospital. Now, you're directly responsible for cost management.
Correct.
And I understand that the income from the hospital is third-party payers,
Correct.
direct pay for services, inpatient, outpatient, and physician visits.
Yep, that is correct. Yep.
Okay. So what is your current reimbursement mix?
Well, primarily we are a critical access hospital. So Medicare is a huge payer for us. That is our largest payer. Then, of course, Medicaid, commercial insurance, and self-pay. We also have managed care, which is the Obamacare, the Affordable Care Act. That fluctuates, but that primarily is in our commercial bucket.
Mm-hmm.
So Medicare and Medicaid are our biggest payers.
Okay. And how long do you anticipate the receipt of reimbursements per accounts? Let's say on private versus public.
Right. Well, we actually get paid from all our payers. Is that what you're saying?
Mm-hmm.
We actually get paid usually within 40 days.
Oh,
that's pretty quick. Some payers we get paid within a couple weeks,
Mm-hmm.
but generally our accounts receivable is collected within 40 days.
Okay. At what rate do payers typically reimburse?
Well, it just depends. When you look at Medicaid, we're getting 16 cents on the dollar. And the way to kind of think that out is when you bill out for a service under Medicaid, for every dollar you bill, you're getting 16 cents. So Medicaid is pretty low, although at least we're getting paid. You can look at a commercial payer, and that can fluctuate. You could have Anthem or Sagamore, and they will pay at like 55 cents on the dollar. I've seen some insurances pay at like 75 cents on the dollar, although that's pretty rare.
Mm-hmm.
But as far as our payers, it just varies. Medicare could be a fixed cost, maybe 30 cents on the dollar. It pays much better than Medicaid.
Mm-hmm.
Just depends.
Okay. How does the cost of charitable expense affect the hospital revenue?
Well, charity is really very important. A couple years ago with our charity care program, we used to, on our revenues are $60 million a year in revenues.
Mm-hmm.
That's what we bill out. We probably did between $100,000 and $200,000 a year on charity. Well, one of the things that I've looked at over the past couple of years was we have a greater need to give charity back to our community. After all, we are a tax-exempt organization. So what we've done is we rewrote our charity care policy to qualify people more for charity. And people always ask, why would we do that? Well, by giving more charity, we're in essence lowering our bad debt expense. A couple of years ago, our bad debt expense was 8% of our gross revenue. Since we've increased our charity care, we have lowered our bad debt from 8% down to 3.5% to 4%. However, we've increased our charity from 0.2% to about 1.2%. So we've lowered our bad debt substantially because, we at the time we were sending all these accounts to collections. The Thursday newspaper here in Sullivan had the hospital's name in it, suing all these people.
Not good advertisement.
We were never collecting a dime.
Yeah.
Very bad advertising. So what we did is we went back, we implemented this charity care policy. We offered to all these people, even who were in collections years in the past, an opportunity to come in, fill out the charity app. We would write off all their accounts, even if they were in collection. Give them a fresh start at life. I mean,
Mm-hmm.
medical bills can be $10,000, $20,000.
Consuming,
yeah, very consuming. And what we've done is we now, on a yearly basis, give about $1 million away in charity. So we've lowered our bad debt, which means 3% is a huge reduction. We've increased our charity a little bit, and we're collecting more money, because what we did is we changed our collection policy where if you're a patient and you come to the hospital, we make you fill out a charity care form immediately, especially if you're not qualified for insurance. We also go through and we have our certified navigators try to qualify you for Medicaid or the Affordable Care Act. And so we look for other opportunities before charity, before charity. But we've done a lot to improve our upfront collections rather than on the back end. And again, charity is just a huge benefit for our community.
Where does the monies for charity come from?
We actually write it off.
Oh, you do?
We just write it off. Yeah.
Okay.
Yeah,
So
we don't
it's
get
just an
reimbursed.
expense?
We don't get reimbursed for it. We actually write it off.
Okay. Now, subsidies such as the DSH help to offset the charitable expenses accrued.
Charity, yep, or a DISH.
Uh-huh.
The DISH program is a program that falls under Medicaid. And at one time, probably 5 years ago, I bet the hospital probably received about $1.5 million a year in DISH money. With all the cuts and all the changes in healthcare, we're receiving half that now. However, as part of the DISH, it's not so much charity that reimburses us, but what they do is Medicaid looks at our bad debts, what we're not getting paid. And I guess charity would be lumped into that pile. But it really looks at our Medicaid utilization. So with high Medicaid utilization, the more of that, the better reimbursement that we will get through the DISH program, kind of as a subsidy.
Is that part of the critical access?
That is critical access and acute hospitals both get DISH.
Okay.
So,
All
yeah.
right. Are there any other subsidies that are available to the hospital
No, not really.
other than
No.
the DISH and the
DISH is the big
Medicare and
one.
Medicaid?
Yep.
Okay. What types of tax credits does the facility participate in?
As a not-for-profit organization, we do not have to file for tax. So as far as having to file a 990 tax form for the hospital, we do not file one.
Okay.
We do file one for the clinics,
Uh-huh.
but we really don't pay any tax on that because we are a healthcare organization. So
Okay. Does the facility utilize any grant monies like SHIP?
we do get some grant monies, but nothing in huge dollars.
Okay. Since insurance is the main source of the hospital revenue, what are the anticipated effects that you foresee from the proposed changes laid out on the new reform packages?
Well, the thing that worries me more than anything are uninsured people. I think that back in a few years ago, Governor Pence at the time expanded Medicaid. And by expanding Medicaid through HIP, I think that qualified like 200,000 Hoosiers for Medicaid that generally wouldn't have been. And what I'm afraid of is that under the changes in health care, people are going to lose their health insurance. Mainly, they're either going to push more on the state, and obviously the states can't handle it. I mean, Indiana, I think we're in a good position. But when you look at like Michigan and some of these states that are struggling, Chicago or Illinois, they cannot take any more expense on their books. They just can't. So what I'm afraid of is the state will have to lower who we cover under HIP, which again is going to reduce
Big pocket.
big pocket of insured. And then, of course, my oldest daughter is 25 years old, and she doesn't live at home. She has 2 children, and she works, but she doesn't have health insurance. And fortunately, she's under that 26-year-old age where I can cover her under my health insurance. Just this year she had gone to the doctor and had to go to the ER, and she had $5,000 in medical bills. Well, fortunately, my insurance covered a large portion of that. So she's only stuck with a little bit of debt for that. I'm afraid that we're going to have people who don't qualify under that rule anymore. A lot of times people are still in school. Kids are still in school and they're 24.
Yes.
And what I worry is that if we have more self-pay people, that means we're going to have less insured out there. And unfortunately, hospitals like us, we don't turn people away. So the charity that I was telling you about earlier, the bad debt's going to go higher. We're going to have, because those people will be above poverty, but they're not going to qualify for some type of government-funded insurance. I also worry that people who qualify for the new insurance plan, that, you know, we call it now the Affordable Care Act. And realistically, if you look at it, it can be affordable if you're, you know, in certain guidelines. Of course, when you're on the very top of those guidelines, it is expensive. But I'm really afraid that it's going to come down to, do people want to eat, or do people want to pay for the health insurance? You know, and I think, I don't know, I'm just afraid that, you know, people aren't going to be able to afford it. Hospitals are not going to be able to get paid from it. Bad debt will go up. Insurance will go up. It just really is scary. I just wish they would take the current program of the Affordable Care Act and make some changes to that to make it function a little better. Because it really doesn't function bad.
No.
You know, I mean, at the end of the fiscal year, like the fourth quarter, when I look at like October, November, and December, I see more utilization for that plan, or more payments from that plan, because the deductible's high and people use it throughout the year. But usually by the end of the year, their deductible's taken care of. So they get those medical needs taken care of, you know, things that they've been putting off. So it really isn't a horrible plan, but let's just fix it and make it better.
Right. Well, you answered my second question. Got it.
Yeah, some are time limited. Yep.
Well, that's great. You've actually answered all the questions that I brought today.
Awesome. Good deal.
Anything that you'd like to add?
No, good luck.
All right. Well, thank you.
Nope,
Thanks a lot.
thank you. Appreciate
Take care.
it.
I think we got it.